am Jim Fazio, and I'm a Unified Therapy practitioner in Rockledge, Florida. We're here today with Dr. Paul Canali at the Evolutionary Healing Institute in South Miami. Dr. Canali is the founder of Unified Therapy, a therapeutic healing process. We're going to be discussing Unified Therapy, what it is, its benefits, and how it can help with traumatic stress, trauma, healing, and evolving consciousness. Welcome, Dr. Canali, and thank you for being here today. What is Unified Therapy? How can Unified Therapy help with post-traumatic stress, anxiety-related conditions, including digestion and chronic pain? Can you talk a little bit about that?
Well, Unified Therapy has dual purpose. There is the one that's actually designed therapeutically for patients, right? And then there's the other aspects designed for teaching and professionals to try to create a unified project that would allow professionals across the board to share common goals in treatment and addressing things like you're saying, post-traumatic stress or just human conditions, pain, suffering, but even consciousness itself. We're trying not to limit ourselves to any one particular methodology or therapy and have looked outwardly for others that are coming to a sort of common understanding. So for instance, I'd have to say this was the age of neuroscience. Many people have been reading about all the interactions of the brain and so on. But what's amazing is that many of those discoveries of the brain are becoming most useful to people that I say use them in a practical way, practical neuroscience. People like Ramachandran, who took a simple mirror and found a new revolutionary treatment for phantom limb pain, which used to be one of the most difficult conditions in medicine. Or Dr. Michael Taub, sort of reinventing treatments for stroke and brain injury, seemingly incredibly simple, constrained, induced movement. That is, if a person had a stroke on the right side, that they would restrain the left side and force the person to go through a series of exercises. But what has happened is they're finding new ways to develop what we call neuroplasticity, new ways of learning and development. And Unified Therapy is really based on trying to understand ways that we can get human beings to move past limitations, whether it's irritable bowel disease or any type of inflammatory disease, or pain, acute or chronic pain, or conditions that are resistant to treatment. Now, we love post-traumatic stress because we feel that in post-traumatic stress, the very nature of it is an incredible teaching tool, because in its nature, it holds so many the keys to understanding what happens when human beings are subjected to incredible levels of stress. And in that case, there's the deep psychological stress, but there's even deeper core stresses. Like, for the first time, the Army has even recognized the diagnostic criteria for guilt or shame, you know. But we really also look at the physiological component, and the amazing tool is that if we can re-regulate parts of the brain's response to fear, which is the limbic system, the amygdala, and its relationship to what we call the hypothalamus and the autonomic. Now, why is the autonomic so important? Because the autonomic has to do with any time we regulate energy and conserve energy. Anything that's going to conserve energy or express energy has to go through that system. And if we can get into it and re-regulate, it's going to change everything.